Well, pain relief denied. That's what devastated patients in West Michigan are hearing from one of our state's top insurers.
Chronic pain plagues 1 in 10 Americans, and chronic pain also helps fuel the deadly opioid crisis. But patients tell Target 8 investigator Susan Samples that they have found relief until big insurance took it all away.
We've shown you how the opioid crackdown is making it harder for patients with legitimate need to access pain meds. Now, another option some depended on for relief is out of reach too. On a postcard-perfect August afternoon, Alex Ostrowski wed her best friend.
I had hoped that I would be able to, walk down that aisle comfortably. And I had hoped that I'd be able to dance. That was pretty important. That was very important.
It wasn't a given.
I really didn't know if I was going to be in a wheelchair. So, yeah. We're going 116 here.
For 6 years, Ostrowski got relief from chronic back pain through joint injections along her spine. Not anymore.
They're not letting us do that.
In the last year, Blue Care Network, one of Michigan's biggest insurers, suddenly stopped paying for the long-covered, commonly used injections. The change came when Blue Care hired South Carolina-based Evacor to handle all of its pain care authorizations.
We're seeing denials, wholesale denials of this particular therapy.
Wholesale denials and other new restrictions that Dr. Keith Javery says is hurting hundreds of his patients alone, robbing them of relief.
We're talking about a procedure that is relatively inexpensive and has given you your life back.
Ostrowski's life almost ended when she was just 12, riding a jet ski on the Sparta Lake where she grew up. A speedboat ran her over and she got caught up in its propeller.
The propeller cut into, the entire left side of my body.
Incredibly, doctors saved both legs, rebuilt crushed bones with metal.
My pain on an average day feels like, I usually say somebody's stabbing you up and down your spine 24/7.
Before Ostrowski found relief through spinal joint injections at Javery, she controlled her pain with high-dose opioids, passing her teens and early 20s in what she calls an over-medicated fog.
It was a dark place. It was a very dark place. And it's terrifying that I feel almost pushed back into that place by them denying coverage of this procedure. They leave you no other option.
I've got a pile of denials here. Target 8 sat down with Dr. William Beecroft of Blue Care Network. What do you say to these chronic pain patients who can't get the treatments they need? Unfortunately, Blue Care Network sent its head of behavioral health to answer questions better suited for the chief medical officer. The company later confirmed it has adopted Evacor's stricter coverage guidelines, saying there's no high-level evidence-based medicine supporting facet joint injections for long-term pain relief.
As you can see, it's very minimally invasive.
Dr. Javery says he doesn't need high-level evidence. He sees it every day.
And the pain relief is drastic.
Priority Health still covers facet joint injections, as do Medicaid and Medicare, though Medicare told Target 8 that's primarily because it's covered them so long, and evidence supporting the treatments is, quote, not strong.
Good, keep that, and I'm right at the joint.
What's clear, there's no broad agreement across healthcare on best practices for pain management. Listen to what Beecroft said about the injections his own employer no longer covers.
Facet blocks have been around since I started practice. They're very effective. They work very well.
I'm frustrated.
So are other West Michigan doctors. In June, Priority Health started using Evacor to handle some benefits, not pain management. But Priority Health recently halted that transition, agreed to pay for all the Evacor-issued denials, and apologized to doctors for unnecessary frustration, delays, and confusion.
We've got to figure out what to do.
Just before her wedding, Alex Ostrowski was able to get an alternative procedure, an epidural injection for short-term relief, just enough to walk down the aisle. She and her new husband had hoped to add to this picture soon.
We're lucky enough to find a woman who was willing to be a surrogate for us.
Because of the boating accident, Ostrowski can't bear children herself.
That's what we thought we'd be doing this year. But yeah. If you don't know that you can walk or work or, you know, I just can't imagine bringing a child into this world if I can't walk.
Evacor explains its decision to target 8 by saying it relies on the strongest, most current evidence-based research to ensure patients get the right care at the right time. Ostrowski plans to ask the state's Department of Insurance and Financial Services to reverse Blue Care Network's denial. I'm Target 8 investigator Susan Samples.